The neck has had a lot of resurgence of attention recently. On the one hand, there are new, lesser invasive devices and techniques that have come out, but there's a stronger force. We call it the tech neck. Young people and older people are spending so much of their time either with their head down or looking at photos of themselves that they can't help but be aware of their neck. There are now alternatives. Kybella, for instance. Kybella is an injection that melts fat, but it needs to be done a few times. So the ideal patient for that is the patient who under no circumstances wants to go to the operating room. The Cool Sculpting company, Zeltiq, has something called Cool Mini, which freezes fat, and they now have an applicator for the neck. And we have a history of that using Cool Sculpting for contouring the body. And the reality is all these procedures now that are used for contouring the body can now be used for contouring the neck. And I think they go together. But the missing piece to this is, if we take the volume out, what happens to the skin? We don't reliably laser the skin. So we've embraced a process called Intensive, which does microneedling and a little radio frequency to help tighten the skin. But at the end of the day, as a surgeon who knows all the treatments, liposuction of the neck can do an excellent job of shaping and contouring. You can feather the entire neck area. It's not just the central neck, it's the entire jawline, and that's very helpful. And in the patient whose skin is really not amenable to just having the fat removed, a very well done, gently performed facelift will give one the best jawline and neck. And I think if we really become very objective about it, we can identify the best procedure for the right candidate and have the best outcomes.